Are you aware that diabetes affects 11% of the population in the United States? Welcome back to Healthy Diet. Diabetes, cardiovascular disease, and cancer are the three diseases that are on the rise in the modern world. Diabetes is one of the diseases that is increasing with age. A balanced diet, along with taking blood sugar-lowering medicine, helps significantly. It is important to keep this information and some of these foods in mind if you have diabetes, or if you have a close friend or family member who has diabetes. By making adjustments to your diet, you can help reduce the effect that you will get from the disease. There is a significant connection between the patient's diet and their overall health. First, keep the patient healthy and avoid malnutrition due to extreme dieting. In fact, some diabetic patients are terrified of eating, dieting, and avoiding a variety of foods, which can lead to a long-term lack of nutrients and major health consequences. Second, take precautions to prevent your blood glucose levels from rising too high due to the unknown food choices you make. For example, reduce the amount of rice you consume, but consume an excessive amount of potatoes and other starches. All because of a lack of understanding about the nutritional worth of each dish. Not consulting has a minimal impact on treatment outcomes. Third, limitations on medicines. If the patient is following the appropriate diet, the patient's blood sugar levels will not continue to rise, and the patient will be limited to taking more medication or not taking medication at all if there is no clinical diabetes. Fourth, lessen the number of complications. Utilizing a diet that restricts blood sugar levels will help to reduce the chance of having complications. When the blood sugar level is excessively high, serious complications can threaten the patient's health. When it comes to the treatment of diabetes, nutrition principles are essential. It is important to keep these 7 rules in mind so that you may select the foods that are most suited for diabetic patients. First, there should be appropriate amounts of protein, fat, carb, vitamins, minerals, and water. Second, does not cause an increase in blood sugar levels after a meal. Third, when you are not eating, try not to lowering your blood sugar. Fourth, maintain your regular daily physical activity. Fifth, maintain your weight at a healthy level. Sixth, does not raise risk factors such as blood lipid problems, hypertension, and renal damage. Seventh, it aligns with the patient's dietary patterns. The following considerations need to be taken into account while preparing meals for diabetics. It is recommended that the patient have more meals between the hours of morning and noon, between noon and evening, and before going to bed. In addition to the 3 main meals that are consumed in the morning, lunch, and evening, the patient should also consume additional meals between the hours of morning and noon. As a result of splitting meals, blood sugar levels will remain stable. It will not rise after a meal and will not drop when you are hungry. People who have diabetes should choose foods that have a low glycemic index, GI, such as brown rice, potatoes, but not baked, grilled, green vegetables, 400 grams per day, and low sweet fruits like guavas, dragon fruits, strawberries, apples, and oranges. When following a diet, it is important to restrict the use of foods that are high in sugar, such as candies, sweetened milk, Coke, and sweet fruits like bananas. Mango, grape food should not be sliced too small or overcooked when cooking. The reason for this is that if you do that, the food will be digested in a short amount of time, and the absorption will cause the blood glucose to rise swiftly after eating and lower the blood sugar when you are hungry or when you are not eating. It is necessary for diabetic patients to make adjustments to their diet in order to ensure that their weight does not fall below a square height x20 and does not go over a square height x22. It is necessary for us to monitor our weight in order to make appropriate adjustments to our diet. In order to make sure that the body's nutritional requirements are satisfied, the diet must continue to supply a complete range of substances, including protein, carb, fats, vitamins, and minerals. Dietary recommendations for diabetics include the following foods: brown rice, potatoes, nuts and beans, green veggies. Fruits that are less sweet include strawberries, oranges, and apples. Sugar-free milk, diabetic milk. A list of foods that diabetics should avoid eating. There are several foods that diabetics should avoid eating, including the following: white bread, baked potatoes, white rice, sugar candies, cakes, soda, Coke. Produces that are sweet, such as watermelon, banana, mango, and so on. Reduce the amount of energy-containing sweeteners, such as sucrose and glucose. Consuming too much salt is not recommended, especially for those with diabetes and hypertension. A few common misunderstandings on the diet for diabetics. Many people continue to spread misinformation about diabetic patients' diets. Patients who have diabetes should stay away from consuming carbohydrate. This is another common misunderstanding. It is not recommended that diabetics quit eating carbohydrate. Rather, the diet should be adjusted so that the daily intake of carb is balanced so that it provides 55% of the body's energy. It is also not true that diabetics can eat noodle instead of rice, mainly due to the fact that noodle is one of the foods that includes a significant amount of carb. It is therefore necessary for individuals who have diabetes to cut back on their consumption of noodle. To balance the nutrients and lower your blood sugar, you should consume about 150 grams of green vegetables and 3 shrimps or 30 grams of beef along with the noodle. Diet plays an important role in treating this disease, ensuring that the body's activities are energized while not causing high blood sugar levels. And that's it for today's video. If you like the video, please hit the like button and remember to subscribe to the channel to catch up on the latest videos.